Hello everybody, it's Ellen. I am exactly 1 week, which means 7 days post-op top surgery with Dr. Crane and Dr. Satterwhite in California. So, yesterday I had my post-op appointment where I got the binder and bandages off, thank God. So, I want to tell you about that appointment, tell you about how I'm doing, tell you about the process, and show you what it looks like, which I'll do in just a second. Um, so, I'm gonna go into some detail in this video, in case that's useful for other people who have surgery in their future and want to know a lot about details, or people who are going to Dr. Crane or Dr. Satterwhite and want to know a lot of details about that, so FYI. So I'll show you what it looks like. I do have the gauze on right now. It's not really that pretty at the moment, but this is what it looks like. So, it's so crazy to be doing this after spending so many years watching other guys, like, post-op videos. It's pretty crazy. It feels good. So, I'll back up a little bit. I'm on my tiptoes. Yeah, that's what my chest looks like. So I'm not going to take this off right now because it's nasty, and I'm not going to take a shower at this moment, so I don't want to deal with that. Yeah, I'm happy with the results. I'm happy with the placement of the nipples and stuff. They are approximately around here, I believe. And it's healing really well. I haven't had any hematoma or any, bad things happen, so I'm thankful for that. Well, obviously you can see some of the incisions. There's this heavy-duty scar tape over them right now. There's not any drain holes because Dr. Crane and thus Dr. Satterwhite don't do any drains. Like, they leave enough lymphatic tissue in there to absorb the fluid and something else, but I don't know what that is, related to their process for not having drains. Okay, where should I start? Well, let's see. I can say something about this tape. The tape is why it looks crinkly. My skin is not crinkly, it's just because of the tape. So this is a brand new kind of scar treatment tape. Not to be really scattered or anything, but before I go on, I just wanted to address the fact that apparently for a lot of people my videos have low volume, which I apologize for, so if it's hard to hear, obviously turn it up, or use headphones. That's what I do when I listen to other people's quiet videos, because if you use headphones, usually you can get it to be louder. So I apologize that my videos are sometimes quiet. I can't help it, because I'm not that technologically adept. Anyway, so back to the scar tape. So, they tell me that this is a brand new scar treatment tape that has just been approved by the FDA, and it's just starting to go into common usage. And I'm the first person at Dr. Crane and Dr. Satterwhite's office, I believe, to be using this. So, I'm getting a free course of this scar treatment in order for Dr. Satterwhite specifically, I think, to see how it will work for his patients, and to see if he wants to, like, adopt it as his primary scar treatment thing. So it's cool that I'm getting it for free. I imagine it might be sort of expensive otherwise. So it's an 8-week treatment. It consists of wearing this kind of wide tape for 8 weeks, and you wear each individual tape for like a week or a little over a week at a time, and then it kind of starts to come off, and then you take it off in the shower, wait a day or something along those lines, and then apply another one that stays on for a week or so, and so forth for 8 weeks. And it sounds like the way that it works is simply by holding the skin together and preventing the scar from stretching out simply by the force of the tape. So the main thing is that it prevents stretching. That's the impression that I'm under from looking at this booklet that they gave me. It sounds good. I mean, if it does what it says it does, if it does what it has done in the studies that they did, then it sounds awesome. If you're interested, I can show you the pictures of success from the booklet. It says stuff like 90% of patients were likely or very likely to use this, called Embrace, again. So apparently it's like really significantly better than other scar treatment methods. That's the bottom line that they're trying to convince me of. So I'll show you results. It's not gory, but it's not pretty. So look away if you don't like looking at scars. So like, I don't know how well you can see that. This is somebody's scar without Embrace, and then this is like, I guess the other half of the scar with Embrace, and it does look better, but I don't know if you can really see that very well. Here is a scar that was not using Embrace. You can see it's really raised and really visible, and then here with Embrace it's very, flat and not that visible. So, if something like that happens for me, I mean, that's awesome. So, I'll keep you updated. I'll be going back to the surgeon's office in 3 weeks for another post-op checkup, and for them to, document the progress of my scars using this method. Oh, well, I should show you the name. So this is the scar treatment name. That's the name of it. I should be getting paid for this, shouldn't I? I should totally be getting paid for giving them free publicity. Anyway. Okay, so what should I talk about? Well, how about pain? I'm not in pain right now. It's uncomfortable. I think the most uncomfortable thing right now is all the tape, the scar tape, and then the tape on the gauze. It just feels like my skin is pulling, but that's not a huge deal. And partly because of the tape, and partly, I guess, just because of the skin tension, I have to put forth a really conscious effort to stand up straight, because after the surgery I was like this, hunched over because of that horrible binder. So I have to really remind myself constantly to stand up, because they told me to do that. It's not really painful, though. I'm not on any pain medication at all right now. I guess along those lines I could talk about sensation. So it's interesting, like, the left nipple seems to have zero sensation of any kind right now. Like, yesterday at my appointment when Dr. Satterwhite was taking the sutures out of that nipple, I couldn't feel anything at all. And he's like, oh, sorry, for poking me, and I was like, well, I can't feel it, so it's okay. But then the one on the right does have a little bit of pain sensation, but actually I'm not sure if that's from the nipple itself or from the surrounding skin that has the pain sensation. I'm not sure. I guess I'll find out when I take this off later today, when I take a shower. And so, I feel like I might have a little bit more sensation over more of an area of my skin than some other people whose videos I've watched. That could be because I had small boobs like that. So the surgeons did not have to like dig very far up in there to get the tissue out. So I can completely feel this just like normal. This is all totally normal sensation up here. This, well, let's see, I can feel that. Cannot feel that. And I can feel this. Well, I can feel that. I cannot feel this here. And then I can feel that. I can feel that. I can feel that, actually. I can feel that. I can feel something there. Feel nothing there. And I'm sure it's kind of the same over here. Yes, I can feel this. I cannot feel that at all. That's really weird. But I can feel this. That reminds me, something that's really weird. Okay, so like yesterday I was having these momentary pains in here. So like I had my shirt on and I was like, "Oh, I feel a little twinge of pain that feels like it's right next to my nipple." And then I would want to find the exact location like by touching to figure out where exactly the pain was coming from. So I'd be like, "Oh, that pain that I feel right now is right next to my nipple, like here." And I was like, "That's not my nipple, that's my incision." But, you know, before the surgery, this skin right here was right next to my nipple. So it's like my brain's ability to sense the location of sensation is skewed because, like, this skin right here, right above the incision, used to be, like, directly, like, next to my nipple, like, immediately above the nipple. But now it's below the nipple. That's weird, but interesting. Um, let's see, what else? Well, let's see. How about ability to move and stuff? Well, I can move like this. I feel some pulling here. So I guess I'm not going above this level of reaching for now. What else? The doctor told me I can sleep on my side. I tried doing that last night, and I was able to lay on my left side for a few minutes, but I couldn't quite relax enough to sleep, so I just went back to laying on my back. So it'll be a little while longer before I can actually sleep on my side and have it be comfortable. Well, what else should I talk about? Was there anything significant from my appointment? Not really. It was just great to have the binder taken off, and there really was a lot of bandaging under there. They had a lot in there simply for padding, and it was interesting to see what they had done with the nipples. Like, so under that binder, they had these, like, pillows actually sewn onto the nipples that were, like, that thick and that wide. It was some yellow padding bandage material. Looked kind of like little pin cushions that were sewn on to protect it. So that was just interesting to see. And Dr. Satterwhite said that there are only like 2 or 3 sutures on each of the incisions, which sounds like not that much. So that's kind of crazy. Other random things. I asked if I should massage the incisions. He said definitely not yet, and that there's really no need to do that, ultimately. Should have written things down, but I didn't really feel like doing that. Yeah, there's not really anything else that I really need to say. Of course, you can ask questions. Um, well, I can say I'm looking forward to taking a shower today, that's for sure. Like, I haven't taken a shower yet because I just had this gauze put on yesterday at my appointment, and then when I got home, I didn't want to bother the nipple grafts again by taking these off to take a shower. But today I will, and, like, I mean, I've taken, like, a bath several times since my surgery, just, like, sitting in the bath without getting any of that wet. But because my armpits were, like, freaking buried in the binder in a vice grip, those have not been washed for a week, which is gross. So, yeah, oh yeah, something that's, I guess, worth mentioning. Yesterday, Dr. Satterwhite told me to try to wear the binder more this week and next week. Like, wear it if I walk around. Basically, wear it as much as I can, because it's supposed to, I guess, prevent swelling and protect the nipple grafts somehow. But, so I was like, what? I didn't think I had to wear that anymore. Like, I tend to not complain about things, because I know that doctors are trying to do their best and help me, so I try to not complain, but I was like, I'm sorry, but that's a downer. So I tried wearing the binder again last night in the evening for, I don't know, an hour or two, and I was sitting down, and then when I stood up, I realized that it really was hurting in this region, and I was like, that's not good. So I took it off, and these had bled a little bit, and I was like, that seems bad, because if they're bleeding, they're disturbed. That, I don't want to do that. That doesn't make sense. So today I called the office, and the nurse told me that, yeah, they're sort of experimenting with having patients wear the binder after this post-op appointment, but she said it's basically optional, but it's supposed to protect the grafts, maybe from being rubbed or something? And I'm like, well, if you tape the gauze down well enough, why do you need to protect them from being rubbed, as long as you're careful in your activities? So I'm like, I'm not wearing that binder, because that feels terrible, and I'm not disturbing the grafts if it makes them bleed. Like, that's not going to happen. So, anyway, there you go. Alright, so that's it. Sometime soon I'm going to make a video about top surgery tips. Like, just little tips for being prepared, tips for dealing after the surgery, and so forth. So you can keep your eyes out for that. Alright. See you later. Bye.